Back, childcare costs in Wisconsin are rising faster than many families can keep up with.
Escalating costs, limited access, and a workforce stretched thin are all contributing factors. Tonight in this special report, Kyrie Lee shares one mother's story about how rising prices shaped her life and what advocates say is at the heart of the issue.
Erin Rogers enjoys these quiet mornings with her 2-year-old daughter, while her 3 older daughters, ranging from kindergarten to 4th grade, are at school.
I, in particular, have looked into it on occasion to maybe go back to part-time work, and it doesn't make sense right now.
A few years ago, high childcare costs pushed her out of the workforce. With limited availability and high cost, many parents and families are forced to make hard choices.
When we had 2 in part-time childcare, I really liked it for them. It was really great that they could have a little bit of interaction with other kids and other people, adults in their life.
But the cost started piling up.
Budgeting became more of a priority because the margins were a lot thinner.
Erin and her husband had to pivot, and she became a stay-at-home mom.
And that is something I don't take for granted.
Look at this one.
I know that's not the reality for a lot of people, especially in Dane County where the cost of living is higher. And I also believe that daycare workers should be given a living wage.
Data shows most children under 5 in Wisconsin are enrolled in licensed group or center-based child care programs. According to Madison-based nonprofit Community Coordinated Child Care Inc.'s 2024 market rate survey, for full-time infant care in Madison, families pay a median of $450 per week compared with $419 per week outside the city. Across all of Dane County, infant care rates range from $165 to $597 per week, depending on the facility. This means the median annual cost for just one infant in the city of Madison is $23,400. That's more than double the in-state tuition at UW-Madison. For toddlers, weekly costs across Dane County range from $150 to $563. In comparison, in Rock County, the median weekly rate is $277 for infant care. Toddler care ranges from $175 to $380. And in Sauk County, the median weekly rate is $250 for infant care, with rates ranging from $180 to $300 for toddlers.
Families, I believe, need to be supported, especially low-income working families, so that they can afford quality child care and not just, go to the cheapest place or have the friend and family. And then I think that the centers need to be supported.
Dahi Wolf, a senior policy analyst at Kids Forward, says Wisconsin is experiencing a child care emergency following the expiration of crucial state funding.
That expired on June 30th, and we were hoping that the Joint Finance Committee would see the wisdom in supporting it to continue. They did not.
The governor requested $440 million for child care support in the state budget, but the legislature approved $330 million. This includes $110 million in direct payments to child care providers that runs through next June. Without adequate funding, Wolf says providers face a staffing crisis.
People can go down the street and work at Quick Trip for more money than they're going to get paid at a child care.
Despite some shortfalls, the state has invested more than $220 million to help families and strengthen access to quality care. Funding will increase Wisconsin Shares reimbursement rates, helping lower out-of-pocket costs for working parents. The new Get Kids Ready program will support 4-year-olds and prepare them for the classroom. There's also funding for a pilot program aimed at expanding access for infants and toddlers, while additional funding will support provider capacity, child care resource, and referral agencies.
We're kind of an island in the middle of the Midwest in terms of what we do to support families and children. I look at Minnesota, I look at Illinois, and I look at Michigan, my home state, and I am so jealous because they are doing amazing things. I mean, Michigan now has free child care for low-income families.
The child care crisis is also affecting women's workforce participation. Wisconsin has historically ranked among the top 5 states for women's participation in the workforce, but that's changing.
And those states that have higher women's participation do better in the economy. We need a public system, just like with healthcare and any of these other things, so that we can really put the needs of those families first.
Looking ahead, Wolf hopes policy changes will come with upcoming elections. Without renewed funding, Wolf says more child care centers could close, leaving families with even fewer options and the state with fewer workers.
No.
You can't have workers worried about where to send their kids every day. You're just not going to get people coming to their jobs if they have to choose between their job and their family.
Reporting in Dane County, Kyrie Lee, News 3 Now.
And about 5% of child care providers in Dane County who responded to the survey plan to raise their rates between now and next month.